My name is Dante Downing. I'm a nursing student at Miles City Community College, and I'm going to be showing how to give heparin sub-Q to a patient. So the first thing I would do is I would go over to my MAR, make sure that I have an order for heparin, and the order is 0.5 milliliters sub-Q to the left upper quadrant, and then I double check, make sure it's the right patient, dose, drug, route, documentation, and time. Alright, and now that everything matches up, the order is correct with what's on the MAR, vice versa, we are good. Let's head to the med room and draw up the heparin. Now I am in the med room, and now I have my equipment here ready. And to start off, I would get my ampule, check it to make sure that there is no fluid at the top, and then I get my gauze. Discard the wrapper, and then wrap the gauze around that blue line and break it away from me. Good there. And discard that in the sharps. Now that that is done, I'm going to open up my filter straw. And then my 27 gauge syringe. Now that that's done, I'm going to remove the needle from the syringe and put on my filter straw. Grabbing this, you can either do it just standing straight up on your table, or you can do it invertedly. We're going to do it on the table without touching the sides. I put in the ampule and draw out 0.5 milliliters of my heparin. Make sure that it's 0.5, and it is. And get the air bubbles out. Now that the air bubbles are out, I can discard of my ampule. Take off my straw. And discard of that. Reattach my needle, and then draw back 0.2 milliliters of air, so it would reach 0.7 total on the syringe. Again, make sure I got no air bubbles. Alright, and then I would gather cotton ball and my swabs for when I head into the patient room. And this is when I would do my second check that I have the right dose, drug, time, patient, route, and documentation. And now I'll be heading into my patient room. Alright. So I come in, knock knock. Before I would leave the med room, I would have a nurse check that I have the right amount.
Looks great, Nurse Dante.
Alright, now I would head to the patient room. I would knock knock, introduce myself. Hello, Mr. Frankfurter. My name is Nurse Downing. I am here to give you a sub-Q heparin shot. Do you know what that is?
Yeah.
Alright. So we'll be giving it in your left upper quadrant today.
Okay.
And before we start, let me wash my hands. And then I would again ask for his name and date of birth with 2 identifiers to make sure that we got the right patient. So now that he has verbalized his date of birth and his full name, we are good to administer our heparin injection. Now I would don some gloves. Alright, now that I have my gloves on and washed my hands, I'm going to get my syringe here and then my alcohol and pick a site. Make sure that it's not the same site that we've been using, so I'm going to rotate, because the nurse before me did right upper, so we're going to do left upper today. I have found my injection site. I'm going to clean it off with an alcohol swab or pad. And now that that's done, I'm going to allow it to dry. Discard these. Now that it's dry, we are going to remove the cap. There. Make sure that it is bevel up when I administer it. And with my non-dominant hand, pull up the skin, taut, I guess is the word for it. And now that we have done that, use my site that I cleaned off with bevel up and administer the injection. And nice and slow, not too quick, not too fast. He has been administered heparin. I'm going to discard of that in the sharps container. Get my cotton ball and clean up any residual blood or things like that that are lying around, and apply some pressure. And then when that's done, assess the site, make sure that everything is okay, and then I would throw the cotton ball away, take off my gloves, wash my hands, and ask the patient if he's comfortable, if he needs anything, give him his call light, and then I am on my way out and heading straight back to my computer to document that I have administered 0.5 milliliters of heparin sub-Q to his left upper quadrant at 0900.